Welcome back. In this video, we'll be discussing reassessing the diagnosis of depression, particularly when the patient's symptoms are not improving despite treatment. Depression is a complex condition, and in some cases, the initial diagnosis may not fully explain the symptoms or the lack of improvement. It's essential for healthcare providers to stay vigilant and open to reconsidering the diagnosis to ensure that the patient receives the most appropriate care. Let's start by discussing why reassessing the diagnosis is important. Depression can often be challenging to diagnose because it can overlap with other conditions, or a comorbid disorder might complicate the presentation. In some cases, the patient may be treated for depression, but if they aren't responding to medication or therapy, it could be a sign that the diagnosis was either incomplete or inaccurate. Re-evaluating the diagnosis helps ensure the patient receives the correct treatment, whether that involves adjusting the current approach or exploring other possible conditions. Step 1. Is the diagnosis of depression accurate? The first step in reassessing the diagnosis is to look at the symptoms and ask whether the diagnosis of depression truly captures the patient's full experience. Depression can be easily misdiagnosed if the symptoms overlap with other psychiatric or medical conditions. If a patient is not improving with standard treatments, consider whether the diagnosis needs to be reconsidered. Some factors to look at include duration and onset of symptoms. Have the symptoms been present for the typical duration of depression, e.g., 2 weeks for major depression? If the symptoms have persisted for a longer period without relief, it may suggest a different diagnosis, such as bipolar disorder or chronic depression. Symptom patterns. Are the symptoms of depression consistent with typical depression, or do they suggest a different condition, like generalized anxiety disorder, bipolar disorder, or borderline personality disorder? Some symptoms, such as irritability, sleep disturbances, or impulsivity, may overlap with other conditions. Co-occurring medical conditions. Conditions like hypothyroidism, chronic pain, or neurological disorders can mimic depressive symptoms. It's important to rule out medical causes of depression-like symptoms before proceeding with a treatment plan. Reflection questions. How can overlapping symptoms complicate the diagnosis of depression? Why is it important to rule out underlying medical conditions when symptoms don't improve with treatment? Step 2. Evaluate comorbidities and additional factors. Sometimes, the diagnosis of depression may need to be reassessed due to comorbidities, other mental health conditions that may complicate the picture. It's common for individuals with depression to also experience anxiety disorders. Anxiety often coexists with depression, and the combination of both can make it harder for patients to respond to standard depression treatments. Bipolar disorder. Depression can be misdiagnosed in individuals with bipolar disorder, especially if the patient has primarily depressive episodes but hasn't yet experienced manic episodes. This requires a different treatment approach, including mood stabilizers or antipsychotics. Substance use disorders. Sometimes, individuals with depression turn to alcohol or drugs as a form of self-medication. The underlying substance use disorder can worsen the symptoms of depression and impede treatment progress. When treatment is not effective, it's essential to conduct a thorough mental health evaluation to screen for these conditions and adjust the diagnosis and treatment plan accordingly. Step 3. Consider other psychological and psychiatric disorders. Depression shares symptoms with other psychiatric conditions, which can sometimes lead to misdiagnosis. It's important to look at the full clinical picture and ask whether the patient's symptoms could be more indicative of another disorder. Some conditions that can resemble depression include post-traumatic stress disorder, PTSD. Individuals with PTSD may experience symptoms like hypervigilance, emotional numbing, and difficulty concentrating, which overlap with depressive symptoms. Personality disorders, borderline personality disorder, BPD, and avoidant personality disorder share emotional instability and low self-esteem, which can mimic depressive symptoms. Psychotic disorders. Some individuals with schizophrenia or schizoaffective disorder may present with depressive symptoms, which could complicate the diagnosis. It's important to conduct a comprehensive psychiatric evaluation and consider these alternative diagnoses if the patient's depression is not improving as expected. Reflection questions. How do comorbidities like anxiety or bipolar disorder influence the diagnosis and treatment of depression? Why is it important to differentiate between depression and other psychiatric disorders with similar symptoms? Step 4. Reevaluate the effectiveness of treatment. If a patient's depression is not improving despite standard treatment, it's essential to re-examine the current treatment plan. Medication. Is the current antidepressant effective? Switching medications or adjusting the dosage might be necessary if the patient is not responding. Psychotherapy. Is the patient engaged in therapy? Consider whether a different type of therapy, such as cognitive behavioral therapy, CBT, or interpersonal therapy, IPT, might be more effective. Adjunct treatments. Consider adding adjunct therapies, such as group therapy, psychoeducation, or exercise, which can significantly enhance the effects of traditional treatments. In some cases, the patient may benefit from more intensive interventions, such as electroconvulsive therapy, ECT, or transcranial magnetic stimulation, TMS, for treatment-resistant depression. Reflection questions. What should you consider when adjusting the treatment plan for a patient who does not respond to antidepressants? Why might adjunct therapies or alternative treatments be necessary for treatment-resistant depression? Step 5. Collaborative approach and referral. If treatment is not effective, after all adjustments have been made, it may be time to involve a specialist, such as a psychiatrist or psychologist. Referral to a mental health professional for further evaluation and specialized care can ensure the patient receives the most appropriate treatment for their specific needs. Collaborating with other healthcare providers can also ensure that any medical comorbidities are addressed and that the patient's treatment plan is as comprehensive as possible. In summary, reassessing the diagnosis of depression is an essential step when a patient's symptoms aren't improving despite treatment. It's important to carefully consider whether the diagnosis is accurate, whether comorbidities or other disorders might be influencing the symptoms, and whether the treatment plan needs to be adjusted. By re-evaluating the treatment and collaborating with specialists, healthcare providers can ensure that patients with treatment-resistant depression receive the best care possible. In the next video, we'll explore monitoring and follow-up care, ensuring that patients continue to receive the support they need for long-term recovery. Let's keep it going, and I'll see you in the next one.